Hi, I'm Claire Daffer and I'm the Widening Participation Officer here at the Trust. This year it's the 10th anniversary of National Apprenticeship Week, so it's quite exciting because thousands of employers across the country are offering apprenticeships. The qualification's nationally recognised and offers different levels from level 2, which is roughly equivalent to 5 GCSEs, right up to level 7, which is equivalent to a master's degree. We will have lots of apprenticeships on offer. On the clinical side, there will be opportunities for clinical healthcare support, allied health professional support, paediatric and maternity support, as well as perioperative care support, healthcare science assistant, pharmacy assistants. On the non-clinical side, we'll be able to offer business administration, customer service, finance, IT, project management, as well as chartered management qualifications and leadership and management qualifications. So the new types of apprenticeships are very different to how apprenticeships have been in the past. It isn't just for young people coming out of school, they do a year or 18 months so they get their qualification. The new apprenticeships are really about opportunities for everybody across the board, so whatever age you are. Some of them will be a year to 18 months, but certainly the degree apprenticeships, so the level 6, level 7 type of apprenticeships can be up to 3 years. So there's scope for everybody and there's development opportunities for everyone.
My name's Lorena Maynard. I work in medical records repair.
Hi, I'm Alex and I'm working in Southwind Theatre.
My name is Raki Gallot. I'm Patient Pathway Assistant.
I'm Lindsay Openshaw. I'm the Project Support Manager for the Care Certificate in the Practice Development team here in the Trust.
My name is Harun Amin. I currently work at the Maternity Department and I'm also doing the Business and Administration Apprenticeship, which is quite new to me. The reason why I wanted to do it was like a career path for me actually. So I can start off somewhere and work my way up.
You learn more about your job role and you become more confident with what you're doing.
It puts a smile on my face because I feel like I've helped someone, you know? And they're not, they're not just a piece of paper or the number or whatever in a queue or whatever. They're an actual person is how I look at the medical records. You know, there's a member of my family and I would like to know that my family is looked after well, so that's how I see it.
Yeah, make it happy when I take the patient back or something and when they are like nervous or something when they are going to have the operation, I try to do some joke or something just to distract them and they are really grateful with me.
I've been in the Trust for just over 10 years. Throughout that time I've worked in a number of roles. Started off in a clinical role and I've used the apprenticeship programme to help develop my career as I go. One of the apprenticeships that I did was when I was working in the care crew. The care crew is a team that look after patients who have challenging behaviour. So a lot of those patients suffer from long-term conditions, some of those conditions being dementia. So I did an apprenticeship in dementia care to help me to understand those patients and look after them better. When I was working in the care crew, I was the team leader for the care crew, which meant that I managed the team and developed the service throughout the couple of years that I worked there. So doing that apprenticeship, whilst it helped me as an individual, as a person working in a clinical environment, it also helped me to develop my team and teach my team different techniques with patients and give them also a better understanding of how to care for those patients.
We have teaching sessions, yes, and then we get given homework which you can do either at your desk or when you take it home. Then we get we have like other study days where we get help with English, Maths and ICT.
So basically I do my normal hours, so I start at 7, I come set up work areas and stuff. On a Friday afternoon, I'm most tend to do a morning clinic, so I do 7 till 12. From 12, my team leader, she lets me actually go into a room by myself and carry on with the apprenticeship. So I do that alongside and I'll take it home and do it there as well. So between the 2 weeks I do have it completed and then I'll have a next visit and it's completed by then it gives me more work to do.
I liked the idea of an apprenticeship because I'm quite a practical learner. I like to learn as I go and learn on the job. And with the apprenticeships, a lot of it is what you're doing on a daily basis and then actually going away, reflecting on that, writing up what you understand of what you've been doing. So you know, for people who like to learn in that way, I think it's fantastic. But actually, working in the trust and still wanting to progress, not have to go off and leave the job that you're working in and go into a full-term learning environment, I think it's a fantastic way of doing that learning and still being able to progress in the career that you want to do.
One of the main responses we get is, but I'm too old to do an apprenticeship. But nobody's ever too old to do an apprenticeship. It's for all ages. It isn't just for 16 to 19-year-olds. You can do an apprenticeship up to the age of 65 or up to the age that you retire, so that it is a development opportunity for everyone.